Hi, this is Asha Clinton, and I'm here to talk to you this morning about the Advanced Integrative Therapy Basics seminar. I want to tell you a bit about it and show you how useful and wonderful it can be so that perhaps you will come and get trained in AIT Basics this coming January. So, I want to start by talking a little bit about where I was when AIT started developing. I was, I think, a pretty typical um, psychoanalytic psychotherapist. I was interested in deeply entering the world, the inner world of clients, because I found that the more we went deeply, the more relief they had from their suffering. And the thing that was so striking to me as a younger therapist was how much people actually suffered. When they came to us, to me, or to some other therapist, they were coming not just because it was a useful thing to do or they might feel better. They were coming because they were in profound pain. And I thought to myself that all the good tools I had learned in graduate school and in uh, other kinds of venues, workshops, other kinds of trainings, two analytic institutes, I thought to myself that with everything I had learned, it wasn't enough. It wasn't enough to help people suffer less to the degree that I imagined was possible. And of course, what I imagined was my fantasy, but with AIT, we've come somewhat close to that fantasy. So every 6 years or so, in the first years of my practice, I would feel impatient. I would feel unsatisfied with what my training was giving me because there would always be one or two and sometimes three clients who were damaged in ways that my training didn't allow me to help them with. And that was very painful for me. So after that period passed, I started looking for new kinds of therapy, new kinds of methods and techniques. So every 6 years, I would find something new. I would think, wow, this is the solution to the problem. I would get trained in it. I would work with it. And indeed, it did improve things. I learned a lot of different kinds of therapy, and my work kept getting better. But another 6 years would pass, and I would be stuck with the same kind of frustration. Then I discovered energy psychology and a number of different types of energy psychology, got trained in all of them. And I thought, we're actually dealing with energy consciously. This should make all the difference in the world. So I discovered that it helped a lot, but the same problem was there. It didn't go far enough. It didn't go deep enough. And I still had a lot of clients who seemed to me to be suffering far too much. And I started fantasizing that someday soon I would get an advertisement or see one in a journal for a new therapy that would put together the energy work with psychodynamic understanding and with understanding from a lot of the other therapies that had developed since the 1950s that I had training in. Someone, I hoped, would put it all together, and there it would be, and it would solve pretty well most of the problems. My clients would suffer less, everything would be wonderful. And I waited patiently, and this did not happen till one Sunday morning in March 1998. And I was resting, and I was napping and reading. And I woke up from one nap and I saw the structure of what came to be advanced integrative therapy clear in my mind. I ran as quickly as I could to write down what I had understood and seen because I was afraid I'd forget some part of it. And when I sat down at my computer to start writing down what I had seen, it was as if my hands were switched to another controller, somebody other than me. and they started writing on the computer. And the first thing that came out was the core belief protocol, which is a protocol which transforms negative beliefs, negative cognitions, schema into positive, realistic ones, and does it very quickly and easily. And it was at that point that I realized that I was the person who was supposed to develop this therapy that had been my fantasy, that it was not a good idea to keep waiting for someone else to do it because I was already doing it, and that I was doing it in a way I had never expected. And that way was very simply to sit in silence, to empty myself out, and then the information would come to me. It's been quite an experience. It's lasted 20 years. The full therapy is still not out there, but enough of it is there so that there are 17 three-day seminars, all of which put together is the equivalent of a graduate training in psychotherapy, except that it takes us further and the healing level is much higher. The first of the seminars that developed is the one I want to talk to you about today. It's called Ait Basics, and it gives you all the basic tools for treatment that you need so that you can do AIT therapy with your clients the day after you finish the seminar. There are a number of things that made AIT different as I saw it developing. The first one was that instead of talking about archetypes, complexes, and a lot of other things, I saw that trauma was the key. I saw that if we could treat trauma energetically, we could probably treat anything that needed treating in a person. And later we discovered it worked in children as well, and even in animals. So what came then was a new definition of trauma. And I want to read that definition to you because I think you will find it very interesting and useful. Trauma is any occurrence which, when we think back to it, or when it is triggered by some present or recent event, evokes difficult emotions, physical symptoms or sensations, gives rise to negative beliefs, desires, fantasies, compulsions, obsessions, addictions, behavior and or dissociation, blocks the development of positive qualities and spiritual connection, and fractures human wholeness. So from an AIT perspective, trauma isn't simply what happens when a tsunami comes and blows everything away, or what's been happening in the state of California here in the US with all the fires that they've been having there. Trauma can be small things, like when you're a kid in school and a friend snubs you and treats you as if you didn't even exist. This may be a small thing for many kids, compared at least to a tsunami or an eruption of a volcano, but it can be equally painful in its way. And when I understood that it's the painfulness that makes things traumatic, that changed us to this new definition. So let's quickly treat a small trauma together. And I'm going to talk you through this because you haven't learned what it takes to do it on your own. So why don't you stop a moment and think about a very simple time that your feelings were hurt. It's nothing cataclysmic, it's nothing big, but it's painful. So for me, the one I remember at the moment is how when I was a little girl, about age 3, I fell down crossing a street in my native New York, and I cut my knee on the glass that was lying there in the street. And this was traumatic for me because my mom wanted to take me to the doctor and get stitches for the cut. And that sounded like the most horrible thing that could ever happen. I resisted her and I got my way. But the hurt of the pain of the cut, as well as my mother's attitude, is still there. So now think of yours. Again, a small thing, but painful. Okay, now I'm going to make a brief phrase that will tell my inner guidance which negative energy, which traumatic energy to remove. So my phrase is, I fell in the street and cut my knee on glass. If I wanted to treat the part about my mother, I could make a second phrase later. So just, I fell in the street and cut my knee on the glass that was there. Please make your phrase, something as simple as mine. So now that we have our phrases, let yourself feel the emotions and the physical sensations you feel about that incident that your phrase describes. In my case, there's physical pain that I can sort of remember still, and there's the hurt feelings of being told I have to have my skin sewn together. Also some anger, because I thought that was terrible. See what feelings you have about your simple trauma. Okay. Now, take one hand and put it on the heart center that's in the middle of your chest. I don't know if you can see mine, but I've put my left hand there. Doesn't matter which hand you use. That's going to stay there during the whole process. Now take your other hand and put it on the crown of your head and say your phrase. I'm not going to say mine simply because I don't want to confuse anything for anybody. So say your phrase now. Now take that same hand and put 2 fingers right on your forehead, just above your nose, and say your phrase. And now we're going to do the same thing with the little crease that's in the middle of our chins. Put 2 fingers on that crease and say your phrase. And now the same thing, putting your hand right at the bottom of your throat where that little dip in your throat is, and say your phrase. Take the same hand and put it on top of the other hand that you have on your heart center. And now place it about 3 inches to the left of your heart center. Say your phrase. Three inches to the right of your heart center, and say your phrase. And now, and I hope you can see this, I'm putting that same hand that's been moving on my solar plexus. Put yours there and say your phrase. And now I'm going to go right onto my navel and put your hand on your navel and say your phrase. And now I'm going to go about 4 finger widths below that, right above the pelvic bone, and put your hand there and say your phrase. And now I'm going to put my 4 fingertips in the crease that's formed by my leg and my trunk, but I'm on the left side, on the left leg. Put your 4 fingers there and say your phrase. And now go to the exact same place, but on the right leg, in the right crease, and say your phrase. And now I'm going to go take my hand, put it under me, and put it between my anus and my genitals, what the doctors call the perineum. A couple of fingers there, and say your phrase. And take a deep breath. And now come back to that phrase. Hands are free. And remember the incident, the trauma that happened that you chose to treat today. Remember it. And let yourself feel the feelings and the physical sensations, if there are any, that are still in you from that incident, from that trauma. See on a scale of 0 to 10, where 0 is no feelings and sensations, and 10 is the most intense possible feelings and sensations. And see where those feelings and sensations are now. As I've been doing this with you, my feelings and sensations about my phrase are a 0. So I have finished my treatment. If you have not yet finished your treatment, please write down the phrase so that you can finish it after we're finished here, because I don't want to take a lot of time away from telling you more about this work. And you're going to repeat the phrase until there are no feelings about it and no sensations. Usually it takes 1 or 2 repetitions at the most. The more AIT you do, the fewer repetitions there are. At this point, when I'm working on my own phrases, I generally go to a 0 in 1 round of work. And what we just did is 1 round of work. Okay. So you have a sense now, I hope, of what a trauma is, that it's something that happened, that left you suffering in some way. Some traumas are gigantic, some traumas are pretty small, but they leave you suffering. And of course, the more you live, the longer you live, the more traumas you suffer. And that's why the older we get, a lot of us are in more pain as we get older, not less pain. But there's something else that's very interesting about traumas, and that is that they form into patterns. And if they form into patterns, their effect is far more lasting and deleterious. When I was first learning all the things I'm telling you now, I realized at some point of treating my own traumas that certain traumas had hit me so strongly, particularly as a child, that they began to recur over and over again in my life. And I saw the same thing happening to my clients. So, for example, in the case of a client whose father had left the family when she was a 3-year-old girl, I observed, as she told me her history, that a few of her teenage boyfriends had left her, also for another woman, and then 2 husbands in a row. When I saw that with her, and I saw equivalent kinds of patterns forming for other clients I was working with, I realized that repetitive traumas, which is what this is, form traumatic patterns. And if they are intense enough, if these patterns are intense enough, they may result in post-traumatic themes and complexes. In other words, they may become very, very big. They can result in psychological disorders, in physical disorders, or in various kinds of spiritual blocks. So it became very important to me to find ways to dismantle traumatic patterns. So what we found, the further on that the development of AIT went, is that if a trauma that originates a given traumatic pattern and the connection between the early trauma that originates the pattern and more recent ones is treated, the pattern breaks apart and it usually stops producing new traumas. In other words, there are 3 parts to the treatment of a traumatic pattern. First, we treat the trauma that started it all. For example, in the case of this 3-year-old who grew up, it would be the pattern of her dad leaving and her finding out years later that he left mom and her for another woman. So we would treat that original trauma, which we call the originating trauma. We would treat the initiating trauma, which is the trauma that happens now. In the case of this client, it was that her husband left her and her 3-year-old daughter. And then we don't only treat those 2 traumas, but we treat the connection between them. And that phrase would sound something like, because dad left me and mom when I was 3 years old, my husband John has left me and my 3-year-old daughter. So you can treat a connection and not just a traumatic incident or pattern. And that's exactly what we teach you how to do in Ait Basics. One of the first thing you learn in terms of method is the trauma protocol treatment. And then you learn what we now call 3-step transformation, which is how to treat traumatic patterns so that they don't come back again. Now, someone asked me recently, how does this work? What makes it work? And I have a few different kinds of answers because it's not a simple question. But what makes it work is energy itself. Because when we were doing our little trauma treatment and putting our fingers or hands on various energy centers, what we were doing was moving energy down the body and out of the body. And which energy were we moving? Because it would obviously be sort of pointless to move just anything. The phrase we made up told the unconscious inside us which traumatic energy to move. So I moved the one about falling in the street and getting cut by glass. And each of you moved some other one. And after we did one round, because we didn't really have time to finish, um, I think you saw that the intensity of the traumatic emotion and sensation was less. In some cases, it had gone totally away, and in others, it was a good deal less. And as I said, if you retreat after we finish talking, then you will have an opportunity to see that it goes to zero and that there's no energy left. So, by moving energy consciously, we are able to affect this kind of very dramatic change. And the more conscious the use of energy is, the more dramatic the shift in energy is when we remove traumatic energy completely. And you'll be glad to know that we can use this new three-step transformation with traumatic patterns with any psychological issue, including even things like the transference countertransference. We can use it with the treatment of illness. We can use it with spiritual issues as well. It seems to work on everything we've tried it with. So, three-step transformation and the basic protocol are the two most important parts of what you will learn in AIT Basics. But there's a lot more you will learn as well. And some of the other pieces are really quite wonderful. The first one, which I think I mentioned at the outset, is the core belief protocol. One of the things that trauma does that's most awful is that it fills us with negative beliefs, opinions, and expectations. And the core belief protocol not only removes those, but replaces them with expectations, beliefs, and ideas that are realistic and positive. So, in other words, you could use AIT instead of cognitive therapy and get a much more permanent result because we shift the energy consciously. Another thing you would learn is a group of meditations which were specially developed to provide physical, emotional, and spiritual presence, to remove stress, to remove anxiety, and to begin developing the spirit in a person. There are, I think, 12 or 14 different meditations that we use, and we would begin teaching them to you in the basic seminar. We also have two other trauma protocols with which we treat trauma very quickly and effectively, and they are wonderful for emergency situations and for humanitarian aid situations. And maybe one of the protocols there that I like the best is the core qualities protocol. One of the things that became very obvious to me the more I worked with the new AIT materials is that people are not only traumatized in the ways we all know about, they also tend to lose, when they're traumatized, a lot of the positive qualities they were born with. It's as if trauma that's significant enough can crush positive qualities. For example, I treated one client years ago who came in to therapy with no compassion or caring for herself or anybody else. It was as if that part of her had never existed or had been erased or had been destroyed in some way. And as an experiment, I started having her work with the qualities that seemed to have been destroyed or seemed to never have been developed in her very traumatic childhood. And what developed from that was the core qualities protocol, which brings back those qualities by installing them first energetically, and then by having the client work with them in a specific way. I think a lot of my clients have felt most deeply about that particular protocol because it felt to them like they were rejoining themselves in some profound way. So I have a few questions here. Some of them were sent in even before we began, but I think that answering them will give you a better idea about what this is about. The first question was, I've heard there are other AIT seminars aside from Ait Basics. Can you say a little about them? And I'm glad to have that question in particular because it allows me to say to you that AIT is not an energy therapy technique. It is a fully developed therapy, and its teaching is divided into, I think, 17 now different seminars. All but one of them are 3-day seminars, and the most recent one is a 4-day seminar. The seminars give you an excellent opportunity to practice everything we teach you. And it's the practice, of course, that makes it easy for you to use what we teach you with your clients. So that's, for us, the most important part. So the first of those, I'll just mention a few. The first of those that I find very helpful is presence and dissociation. In this seminar, you remove the trauma that keeps you from being present. And what happens when you learn the methods and you use them with your clients is that clients who were ungrounded become grounded. If they were unembodied, they become embodied. If they were cut off emotionally in one way or another, they become able to feel and deal with their feelings appropriately. And if for some reason they're unable to think with any clarity, that also comes back. So it's a very important seminar for those clients who are seriously interested in feeling themselves as whole people, in becoming whole. Another one that I like very much is called depth treatment. It gives you a new way of working with objects and archetypes if you're analytically oriented. And there are some real breakthroughs in that seminar. My clients, also our teacher cohort in AIT, are very, very involved with the contents of that seminar. And I think it's one of the most popular ones. There's also the character structure treatment seminar, which is a new way of treating personality disorders. That by itself is worth a good deal. And there is an attachment disorder treatment seminar as well, where we work on all the issues of attachment, and it includes a sizable protocol which treats symbiosis very, very effectively. There's also one wonderful spiritual seminar called Treating the Wounded Spirit. It's a way of removing trauma from a client's spiritual being, so that whether the client is interested in developing spiritually or has no interest at all, the blocks from that part of the client's being have been removed. So there are a lot more, but that just gives you a little taste of what's available. And the next question I got was, can AIT work with any traumas? And the answer is AIT can work with any trauma. It's that simple. Even with people who are so damaged that when you ask them, is there a safe place for you in this world? And they will tell you no. Even the traumas that causes that kind of lack of safety and that kind of distrust are amenable to AIT treatment. Another question that was asked is, how old can an AIT patient be? And does AIT work with children? One of my favorite clients came into therapy at the age of 92, and we worked through her traumatic material quite thoroughly. She's now 103 and in pretty good health. I have a strong feeling that AIT played a big part in her already excellent longevity, but gave her at least another decade. So I'm very pleased about that. And in terms of children, My youngest AIT client was 6 months old. And when her mom brought her in, she rocked her in her arms until the little one fell asleep. And I was able to work on her while she was sleeping. And the issues she was having, which were typical baby issues, she couldn't tolerate either breast milk or cow milk. And the result was that she could very nicely tolerate breast milk. And once the pair of them got used to using breast milk again, which was not easy, I had to treat the mother for that. Both of them were able to deal with the little one getting fed without any allergies and without any trauma. It was pretty wonderful. And I've treated a number of kids. There's also an AIT committee which has been working on rewriting protocols in the basic seminars so that we can extend what we can do for children. And that's in process as we speak. And one of my favorite questions, which people always ask, is here on the list too. And that is, can an AIT therapist apply AIT to himself or herself? How does it work? Well, in the little taste of the trauma protocol that you had a few minutes ago, you discovered that you were doing exactly that. You were applying AIT to yourself. And it works exactly as we began, except that it has a full end in the sense that we don't stop until we have a 0. Also, my experience has been that most AIT therapists work on themselves as a matter of course, because like most therapists in general, they've learned one very salient thing, and that is that, excuse me, you cannot treat someone for something that you haven't been treated for yet, because you can't see it clearly enough. You can't have the level of insight and clarity about it if you still suffer from this particular thing, whatever it might be. So yes, you can work on yourself. I'm looking to see what other questions were in this list. Here's an interesting question. It says, according to me, what does a therapist need to become a great AIT therapist? I guess I would say that what a therapist needs to be a therapist in general is a big, compassionate heart, a strong mind, good boundaries, clear intuition, and the ability to organize treatment. It doesn't have to be an AIT therapist. It could be any therapist, and I would probably say that's what's needed. And my own personal bias, of course, is that every therapist needs a developing spirit as well, but that's my bias. We don't require anything of the kind in AIT. The other thing is that the AIT practitioner, to become a great AIT therapist, needs to take all the seminars. Doesn't have to do it quickly. In fact, if they do it slowly, they will learn the materials much more deeply and they will do a better job. And the second thing that's really important is supervision. Once you've learned how to do all the protocols, for example, in the Ait Basics seminar, it's really good to have supervision so that someone else is looking over your shoulder and correcting any misunderstandings you may have had. That way, when you work with your clients, you know you're doing it exactly as it was developed, and exactly as 20 years of clinical experience indicate is useful and good. So supervision, taking as many seminars as you can, and you can't leave out your own work on yourself. I think our best practitioners are the ones who are working on themselves a lot. So that's how I think you become a great AIT therapist. Another question that a number of people have asked me over the years is how important is muscle testing for AIT's work? Let me tell you the difference between using it and not using it. Now, when we were doing our little bit of a demo earlier, I had you go down the energy centers, and after we were all the way down, I asked you on a scale of 0 to 10, where are the feelings and the physical sensations now? And you felt inward, and you gave yourself an answer. It's a 3, it's a 0, it's a 7, whatever you got. In other words, you were estimating how much of the traumatic after effects were gone after you did one round. Your estimation could have been right on target, or it could have been wildly off. That's where muscle testing comes in. No matter what form of therapy we're talking about, no matter which modality, there is little or no excellent way to measure how much has gotten done in a particular period of time, like the time it takes to go down the energy centers. So what muscle testing gives you, if it's performed correctly, is knowing for sure that you have finished treating a particular trauma, instead of hoping that the client's estimate of how much has been treated is an accurate one. It can be the difference between treating a trauma and it's still wildly active in creating suffering for a person, and treating a trauma and it has stopped adding to the suffering of that human being. So as long as muscle testing is done correctly, it is what tells you when something is finished. It is what tells you how much work needs to be done, how much energy needs to be removed. Without that, you're actually flying blind. Now, why did I mention if muscle testing is done correctly? It's very important. To do muscle testing correctly, you need to put your ego aside. It's easy to follow the instructions that I'm going to give when I teach muscle testing in January to those who register for Ait Basics online. Those things are easy. It's far less easy to let go your ego's desires. For example, if I'm tired and I'm working with a client at the end of the day, I might want the muscle testing to go to 0 after one round of treatment because I'm too tired really to do much more than that. That's going to mess up the muscle testing because I won't be empty of desire of any kind. However, if it's the end of the day and it's the same client and we're treating the same trauma, and I have, so to speak, put my ego in my back pocket so that it is not affecting how I feel about this treatment, how I feel about how long it will take for treating this trauma to happen. If I have no desire, positive, negative, or otherwise, then I can get an accurate muscle test. So during the Ait Basics seminar in January, we'll be looking a lot at how accurately we can muscle test and how clearly we can put our egos aside. We'll learn to do that. Okay, so I've told you a little bit about AIT, and I've told you a little bit about the basics seminar. I think what I haven't said that's really important is that once you've taken basics, you can take any of the other seminars. And what that means is that basics is like an open door. Once you've walked through it and done what is behind the door, which is take the seminar, it opens a world of improved treatment for you. It opens a world where your clients are going to get better faster and their treatment is going to last far longer. than you've ever seen before. It's a world where far more complex and difficult traumatization can be treated fairly easily. It's a new world where therapeutic treatment is concerned. So, if you would like to register for the Ait Basics seminar that I will be teaching in January, I'll be teaching it beginning on January 5th, when we'll have a short session just on muscle testing. And then the following 3 Saturdays, I think we begin at noon, the following 3 Saturdays as well. This will give you not only the full training in Ait Basics, but it will give you a week between each segment of the training so that you and a partner will be able to practice. By the time you're finished with that seminar, in its 4 segments over the month of January, you'll be twice or 3 times as experienced as most people who've taken it before, but they've taken it live because they take it all at once in a 3-day period. So it's a very good way to take the seminar. You'll come out really knowing the materials well, and I will do my best to make it not only interesting and useful, but a deep and lovely experience. To register, please go to the AIT website, which is ait.institute, and register there. And I look forward to seeing you on the 5th of January. Many blessings. Think of this as you being a soldier in the army that marches against suffering of human beings everywhere, and the occasional cat and dog. Bye, everyone.